So, COVID testing, why is it so hard and confusing and what to do about it? Is really, I'm going to give you kind of a pretty high level overview. There's a lot of nuances to this, and I'll leave some time for questions if anybody wants to, pursue some discussion into that. But it is very difficult for a couple of reasons. One is, as I alluded to in our earlier session, as we were talking before the meeting actually started, vaccines, and in that context, testing, we've never, ever, ever done this kind of a testing or even vaccine challenge. We've never tried to inoculate 300 million people or 6 billion people at a time. We've never tried to test 300 million people or 100 million people or a billion people at a time. So our system, makes it very difficult. We have a decentralized system, so everybody does it differently. Everybody has different mechanisms to do it, and the healthcare system in general is not very agile. It has a certain way of doing things, and that's pretty fixed. Brian alluded to the transformations that are taking place in healthcare, and a lot of that is being driven by COVID. It really comes down to this idea that says, I think Rahm Emanuel said it earlier in the Obama years, never let a crisis go to waste. And this crisis, really to the long-term benefit, is going to transform healthcare, because we have not been able to grapple with the challenge of COVID, either from a vaccine or from a testing standpoint. The other factor is that technology is evolving very quickly. Typically, evolution in the healthcare system is very slow for a lot of good reasons and a lot of bad reasons, but now it's going at light speed. And so the system is almost unable to keep up with the level of innovations that are taking place. So what is testing as we hear of it? There are basically three types of tests out there. The first one up there is an antigen test. You may have heard this. It's essentially measuring proteins. And are you carrying proteins associated with the coronavirus? It's about 15 minutes, so it's very fast. It requires minimal training to do, but it requires a healthcare provider to do it, so you can't do it yourself. And the accuracy sensitivity is a bit of an issue, especially from an FDA perspective. It's about 80%, which is, depending on what you're trying to accomplish, is not considered by the conventional system to be appropriate. But it gives you a good sense relatively quickly. The second one is sometimes called a PCR test. Sometimes it's called molecular or DNA or RNA. This is the gold standard. This is how all of these tests have been done for the past 25 years. It takes 2 to 4 days to do, and it's done in a clinical laboratory, either in a hospital or in Quest or LabCorp or any major laboratory. And it will tell you with high accuracy if you have COVID. The antibody test simply tells you if you've had it. It doesn't measure if you have it, it just measures that you had it. So it measures the immune response within your system. Obviously, when you have this disease, your body responds by building antibodies, which are sort of just defense mechanisms, and they hang around in the bloodstream typically, depending on the disease state, sometimes for a lifetime, like mumps or measles, and sometimes for a short period of time, like 6 months, a year, for like the flu vaccine. So antibodies are also measured for COVID. Now, this is a little bit busy, but I think it's important to understand from a COVID standpoint. So the yellow and the purple and the red curves, this is the onslaught of the disease. So if you think about the yellow, where it says standard PCR, so from initial infection until about 5 days, the PCR machine is going to pick it up. Now, remember, it's 2 to 4 days, so that's a problem. And you may not even know you've been exposed for 4 to 5 days. So that's a little bit of a challenge, right? Because by the time you find out, you may have infected a bunch of people. So, from a public health standpoint, the PCR test is very good at telling you if you have it, but it's not very good at stopping you from spreading it, which is why the default response is if you've been exposed, you should isolate. The second, the purple curve there, if you will, is the standard antigen rapid test. As I indicated, the rapid test is not as sensitive. And so, therefore, the viral load, the amount of virus in your body, has to be at a higher level. So, you can just imagine very simplistically, if you're exposed to somebody who has the virus in the early stages, day 1, day 2, even day 3, nothing is going to pick it up. So if you find out you were exposed last night or yesterday from somebody from COVID and you run and get the PCR test, it's going to come back negative because nothing is going to pick it up in those very early stages. So if you call your healthcare professional, they'll probably tell you wait a few days, 3-4 days, and then get tested. And this is why, because the curves are showing as they rise, that's just the viral capacity in your body. As the viral load or the viral number gets higher, then you start to have symptoms, and then it's very clear that you want to get tested, and then you could get the PCR test, but that's 2 to 4 days, and it's very accurate, or you can get the antigen test. So why would you do either? I'll cover in just a moment. The longer red curve is really the antibodies. So they remain in your system post-infection. You're no longer contagious, but they're part of your antibody system. So what do you do, right? What's the message? So if you've been exposed, if you find out you've been exposed, from a public health standpoint, you should isolate 2 to 4 days at the outset. And then you have two options in front of you. Option number one is to take a PCR test, go to an urgent care clinic, any number of places will do it. It's covered by insurance, and you wait 2 to 4 days and you get confirmed if you have it or not. Option number two, which is not covered by insurance, bit of a different conversation. You pay $200 to $250 and you get a rapid antigen test and you have the answer in about 15 minutes. Either way, you got to wait 2 to 4 days. There's no value in getting a test a day after you find out you've been exposed. No test in the planet's going to pick it up. So you have to give it some time. If you develop symptoms, then and symptoms, as we've heard about, that's pretty well publicized. It's temperature, or you don't have taste and smell, or you're fatigued, or you have some breathing issues. Just isolate for 10 to 14 days. That's the go-do. And having a test that confirms you have COVID is not going to change that activity, that counsel, that mandate. So you can take either test or not take a test. You don't have to take one, because if you isolate 10 to 14 days, you're going to come through the disease state in most cases. And of course, there are things that your healthcare provider would tell you to watch for. In that case, you might end up going into the hospital, God forbid. But there's no need to take a test once you have symptoms. You just have to isolate, in my opinion. Okay, so a couple of things I'll close on, and then I'm happy to take some questions. Today, there are fast point of care PCR tests available that can, and even home use technologies that can give you an answer in 30 minutes. Those tests are available. They're simply not in the system yet. They're not either approved by the FDA or there's not a good distribution mechanism. So there are faster, accurate technologies on the horizon. They may help with the COVID epidemic. They will certainly help with future epidemics or pandemics. Medicare and insurance needs to pay for rapid PCR point of care tests. Part of the challenge, and this is just, a little bit of a sidebar, the challenge we face in our healthcare system is that PCR test that you wait 2 to 4 days for costs about $1,000 plus or minus. And you've got highly trained technicians. You've got a test that takes 9 to 10 hours to do. It goes to a big hospital. The point of care rapid antigen test cost about $5. So, from a total healthcare cost standpoint, there's a place for point of care rapid tests, and Medicare currently doesn't pay for them, which is why they're kind of outside the system. You have to pay cash. There's a lot of discussion about how we're testing for COVID. There's a public health testing school of thought that says test often, find out if you have it early, and then isolate. And then there's a school that says test to see if you have it, and the longer you wait, the better the answer. So there's a whole conversation going on within the public health community about how do we minimize the spread. And I think we've learned a lot and we'll learn more, and I can expand on that through questions if necessary. But suffice to say, our whole testing strategy will change, which leads me to our last comment here. Again, our healthcare and diagnostic system is based on symptoms, right? You have some symptoms, you go to the doctor, he or she orders a test, and then they tell you what to do. That doesn't work for COVID. Can you imagine everybody going to the doctor and getting a test? That's essentially what we're doing. And the system is not able to handle that. So the opportunity presented by this crisis is our ability to rethink the way we do testing. And there are a lot of constituents. There's a lot of, you may remember the book, Who Moved My Cheese? There's a lot of change involved in this that will result in I think, a better system in the end.